Welcome to Mastering EKG Interpretation Basics, where we'll guide you through understanding the fundamentals of reading and interpreting electrocardiograms. This comprehensive course will equip you with essential skills needed for accurate EKG analysis in clinical practice. An electrocardiogram, commonly known as EKG or ECG, is a vital diagnostic tool that records the electrical activity of the heart. This non-invasive test captures the heart's electrical impulses as they travel through the cardiac tissue, providing crucial information about heart rhythm, rate, and overall cardiac function. The electrical signals are detected by electrodes placed on the skin, creating a visual representation of the heart's electrical activity that helps healthcare providers diagnose various cardiac conditions. Let's explore how blood flows through the heart and its relationship to electrical activity. Blood enters the right atrium from the body, flows through the tricuspid valve into the right ventricle, and is then pumped to the lungs. Oxygenated blood returns to the left atrium, passes through the mitral valve to the left ventricle, and is finally pumped to the rest of the body. This coordinated movement is orchestrated by electrical impulses that trigger each chamber's contraction in precise sequence. Understanding depolarization and repolarization is crucial for EKG interpretation. Depolarization occurs when cardiac cells receive an electrical signal, causing them to contract. This process involves rapid changes in the cell's electrical charge as sodium ions rush in. Repolarization follows as the cells return to their resting state, with potassium ions moving out of the cells, allowing the heart muscle to relax. These electrical changes create the distinctive waves we see on an EKG tracing. The heart's electrical conduction system is a sophisticated network that ensures coordinated cardiac contractions. It begins at the sinoatrial node, or SA node, our heart's natural pacemaker. The electrical impulse travels through the atria to the atrioventricular node, or AV node, which briefly delays the signal. From there, it rapidly conducts through the bundle of His, dividing into left and right bundle branches, and finally reaches the Purkinje fibers, which stimulate the ventricles to contract. The PQRS complex represents different phases of the heart's electrical cycle. The P wave shows atrial depolarization as the electrical signal spreads through the atria. The QRS complex represents ventricular depolarization, with the Q wave showing initial downward deflection, the R wave marking the main upward deflection, and the S wave completing the downward movement. Finally, the T wave indicates ventricular repolarization as the ventricles return to their resting state. EKG paper is standardized to ensure accurate measurements across all recordings. Each small square represents 0.04 seconds horizontally and 0.1 millivolts vertically. 5 small squares make up one large square, equal to 0.2 seconds horizontally and 0.5 millivolts vertically. The standard paper speed is 25 millimeters per second, and voltage standardization is typically set at 10 millimeters per millivolt. These standardized measurements are crucial for accurate interval and amplitude calculations. A systematic approach to rhythm analysis ensures accurate interpretation. Start by calculating the heart rate using either the 6-second method or the 300 rule. Next, assess rhythm regularity by examining RR intervals. Then analyze P waves. Are they present before each QRS complex and consistent in shape? Measure the PR interval, which should normally be between 120 and 200 milliseconds. Finally, evaluate the QRS complex width and morphology. Normal sinus rhythm displays several key characteristics. You'll see regular P waves preceding each QRS complex, with consistent PR intervals. The QRS complexes should be narrow, typically less than 120 milliseconds, and uniform in shape. The heart rate usually falls between 60 and 100 beats per minute. The rhythm should be regular, meaning the distance between R waves remains consistent throughout the strip. When interpreting EKGs, certain findings require immediate attention. ST segment elevation might indicate myocardial infarction, while depression could suggest ischemia. Irregular rhythms, especially when accompanied by missing P waves, might indicate atrial fibrillation. Wide QRS complexes could signal bundle branch blocks or ventricular rhythms. Always pay attention to significantly prolonged intervals, as they may indicate conduction abnormalities requiring urgent intervention. We've covered the essential fundamentals of EKG interpretation, from understanding basic waves to recognizing critical patterns. To reinforce your learning, we encourage you to take our interactive quiz on our YouTube page, Study Nurse IQ, and practice these concepts regularly. Remember, mastering EKG interpretation takes time and dedication. Visit our resource center for additional materials and continue building your expertise in cardiac rhythm analysis.